we're trying to achieve that same sense of, you know, that it's a conversation about a fascinating topic and original documents amongst ourselves as much as with the expert who's presenting to us. So just please feel free to come with your comments and observations and questions and speak to each other as much as you are asking Sid, who will be presenting your questions. So here's how it works. Sid is going to give about a 20-minute presentation, during which time it's probably best if we just hold off on our questions and comments in the chat. And then after that, we're going to open it up to everybody. You can raise your hand.
Two things.
Sorry, I've lost everybody here. I don't know what, Sarah. Can you see me?
Yes.
Okay, but I can't see you. Somehow something's gone wrong with my Zoom
Can
page.
see and hear.
You can see and hear. Okay. Well, anyway, if you go to the bottom of the screen, and if you go to the bottom of the screen under with the little icon that says participants, click on that, and it'll tell you to raise your hand, and that's what you want to do if you want to speak during the meeting. Does that make sense to everybody?
Mm-hmm.
Yeah. Okay. So that's the best way. James, could you let me in? And this is a further comment. Could everybody mute themselves? Because otherwise we're hearing all your home events. And so now, I'm sorry, I can't see myself. So, and I'm not getting into the meeting. So sorry about this. I'm going to introduce briefly Sid and then hand over to him. Sid Levitsky is a pioneering cardiothoracic surgeon of many, many years. He was really second generation of the cardiac surgeons in this country. So when the mortality rate for surgery was very, very high, he's been the recipient of numerous NIH grants and has worked all over the world. And he's now the Cheever Professor of Surgery at Harvard Medical School and the Vice Chair of the Department of Surgery at Beth Israel Deaconess. And most importantly, he's on the board of the Partnership of Historic Bostons. And will lead our discussion this evening on the pestilential pox, comparing COVID and smallpox in the 17th century. So over to Sid.
Well, thank you, Sarah.
Mm-hmm.
As Sarah just mentioned, we're going to be talking about smallpox, and we're going to talk about COVID-19 and see how they're related and what we have learned in the past historically from smallpox, and see if that's going to help us now in managing COVID-19. So let's just begin. And I'm just going with this slide, compare smallpox and COVID-19. I hope all of you can see my slide. They're both viruses. Smallpox allegedly began in Egypt in the 3rd century BC. COVID-19, we believe, began in China. At first, it thought it was 2020, but there were a few cases retrospectively that occurred in the United States in 2019. So sometime during 2019 is when COVID-19 started. As far as the treatment is concerned, there is no treatment for smallpox. And there's somebody talking. I think if you mute yourself, will be okay. Good, thank you. And there is no real treatment for COVID-19. There has been some antibody treatments, some manufactured antibodies that are only useful before the disease begins to advance itself. And there's real question of what these antibodies accomplish. So in reality, similar to smallpox, there is no treatment for COVID-19. Mortality for smallpox is 30%, a very high mortality. Mortality, we think, and there's lots of we thinks and perhapses when talking about COVID-19, because it's a relatively new disease for us, is probably about 0.2%. But one way of looking at it is to compare different countries. United States has the highest mortality, about 816 deaths per million patients. In Germany, it's 197 deaths per million patients. The morbidity, what are the after effects of smallpox, is scarring and blindness. In the United States, the morbidity involves the lung mostly, or in the Western world, it's mostly the lung, but it's a multi-organ illness, so it could affect the brain, the heart, the kidney, the extremities. So it's ubiquitous as far as the body is concerned. The last case of smallpox that's been documented was in 1977. We have not had the last case yet, unfortunately, of COVID-19. Hopefully, eventually we'll get there. Transmission from smallpox is airborne and surface contamination. There is, for COVID-19, it's mostly airborne. There's a little respiratory droplets. There's a little bit of surface transmission, but for the most part, it's airborne. Prevention is vaccination for smallpox, and we hope that prevention will be vaccination for COVID-19. There's a lot of speculation. There are excellent models done by superb scientists. We think that's going to occur, but that remains to be seen. So what about smallpox in North America and New England? Because the Partnership of Historic Bostons focuses its interest in the 17th century in New England, but mostly Boston and Massachusetts. And there's a concept called the virgin soil hypothesis, which tells us that the indigenous people, the Native Americans, had not experienced many of these diseases such as measles, influenza, smallpox until the European immigration occurred in North America. And smallpox for the Native Americans was about a 90% mortality. And also measles, influenza, and smallpox was not present in New England before the Europeans arrived. John Winthrop, who migrated to Boston in 1630, thought with his concept that this land had been taken over by God and had essentially given the Indians this miraculous plague whereby a great part of the country is left void of inhabitants, and so the Europeans could settle in Boston. This was his religious concept. There were many epidemics in New England beginning in 1612 that have been documented with the Micmac tribe, 75% mortality. Another time in 1612, the Wampanoags, and then in 1616, the Abenaki, the Massachusetts, and the Wampanoags again. We're really interested in first contact with the Europeans, and the Europeans began coming to North America, particularly from England, in the 1480s, and they were really fishermen. But as you could see from the slide, there were many people coming from Europe, beginning with Verrazano in 1524, Cartier, Champlain, Gorgeous in the 1700s, and Smith in 1614. And by 1580, the late 1500s, there were about 350 to 700 fishing ships each summer, which would be poking around in New England, sometimes landing, trying to trade with the Indians, or kidnapping some of the indigenous people and enslaving them in Europe. So there was a lot of contact, and this was the method by which the Native Americans began to get infected, and the die-off, the great die-off and great mortality of the Native Americans, involving all of these diseases, measles, influenza, and smallpox. And this was tragic. This is just a slide indicating the Boston epidemics from 1630 to 1798. The ones in yellow are the major epidemics, and you could see in 1640, there was a major epidemic in Boston, 1660, and it continued on. So this was a recurring disease. Every 2 or 3 years, it would begin to pour out within the society. But the major epidemics, really the ones in yellow, 1640, 1677. And unfortunately, so we're going to show some medical pictures now, and I hope people will tolerate it. This is what smallpox looks like. It's a horrible disease with pustules throughout the entire body, including the mucous membranes, the eyes, and that's why there was such a high incidence of blindness, and patients couldn't eat, and many of these pustules would get secondarily infected, and it was just a horrible, horrible disease. And this is what happens when it becomes hemorrhagic. Blood goes into the pustules, and you could see how this overtakes the body. So it's a horrible disease. And this shows some of the remnants, the pox marks that many people in New England would exhibit after experiencing this and surviving. And what was the treatment that was available in the 17th century? And it was really based on Galenic medicine going back to the 1st and 2nd century AD. It was based on some Hippocratic imbalances in bodily fluids. There were humors that were considered at that time blood, yellow bile, black bile, and phlegm, and that the body was composed of 4 elements: heat by fire, air was dry, moisture by water, earth was cold, and the disturbances of these bodily elements is what caused the illness. They knew very little about medicine at that time. There was some primitive animal dissections of monkeys and pigs, and a few human dissections, but the knowledge was very minimal at that time. So what was the medical therapy? What were the options that physicians had in the 17th century during the times of our Puritans coming to Boston, or the Pilgrims coming to Plymouth? They had bleeding, which was exsanguination of the patient, which was deadly, cupping, emetics, where the patients would be forced to vomit, blistering agents, sneezing powders, different botanicals, and in the 1400s and 1500s, people began to introduce chemicals such as lead and mercury, particularly for treating venereal disease. And then there were religious feelings, such as Count Mather with his angelic conjunction, and we'll get to that in a few moments. So what about the Native Americans? What did they have? And they had a form of Galenic medicine also, and it's also a form of religious medicine. They had similarities. The Seneca Indians treated rattlesnake bites with thistle plants. They had a belief very similar, like Galenic medicine, that internal maladies due to no visible cause is a work of evil spirits. They tried to drive the devil away by making noise. They anointed their body with greases to protect themselves against mosquitoes. So it was really very similar to Galenic medicine. And as far as doctors in Massachusetts, there were very few who had real diplomas. Most of them were apprentice training, see one, do one, and then teach one. The Mayflower log tells us that there was a physician, Dr. Samuel Fuller, on board. There was a barber surgeon by the name of Heel, and he returned, he didn't like Plymouth, so he returned with the Mayflower in 1621, and 2 others whose names somehow have been lost. Over a period of about 170 years, from 1630 to 1800, there are only 1,300 doctors in all of Massachusetts. Only 25% were really formally educated. And it was very difficult to get any physicians. Most were snake oil salesmen, home apothecaries, or people who declared themselves as doctors. So in doing this, I decided that we would get some pamphlets or medical textbooks, or not really textbooks, but pamphlets, first in England, And this is going to be the first one that I gave for reading is John Lampert. This was a small one. And then we'll go on to the next one from Thomas Thacher, which came from Boston. So this is John Lampert's one. And he felt that this disease was, first thing, he was a practitioner. He advertises himself as a practitioner in surgery and physics in 1685 in London. He felt this disease, smallpox, was so great a mortality that the physicians didn't really want to take care of patients because they were fearful of taking the disease themselves. And if you compare it to COVID-19, when physicians now go to see patients, we're covered in gowns and masks and goggles, and physicians and nurses and respiratory therapists, all the people taking care of patients with COVID-19 are terrified of getting the disease themselves or bringing the disease home to their family. He claims that Mr. Lampert, or Dr. Lampert, he was not a barber surgeon, so he's Dr. Lampert, that he put together this little pamphlet, not to teach the learned physicians, but the real people who were taking care of the patients with smallpox, the poor, ignorant tenderers of the sick, because these patients couldn't afford to pay a silken doctor to feel their pulse or hold some perfume to their nose, because that was also a treatment. And again, as we'll see in a few moments, going back to the Native Americans and Cotton Mather, he said, "I must advise you not to rely too much on the use of the most excellent medicines, but pray to God with sincerity and faith." So they were hoping that their prayers would be able to treat them. This Dutch physician in the middle 1600s reflected the classical Galenic medicine and treatment of smallpox. You locked the patient up in a room, no cold air, covered them with blankets, let them sweat, waited 14 days, hoping that the pox would leave the body, because if you allowed them to cool off, the pox would go into the body. And it was better to let the patient bear the stench. There was very poor hygiene among Europeans in general, but particularly those who had smallpox, and they would be in their linens, covered with their waists, waiting for the smallpox to disappear for those who were surviving at the end of 2 or 3 weeks. So, let me go back to Thomas Sindhin. Was a major physician in London in the 1600s. He was a Puritan, a real focus in supporting the Puritans. He was an officer in Oliver Cromwell's army, and many people declared him the English Hippocrates. He wanted to change this Galenic medicine. He felt that the patient should rest in bed, they should have their clothing changed, they should have plenty of air, they shouldn't be forced to sweat under a lot of blankets and get cool drinks, but most important, to avoid bloodletting, because he felt that bloodletting was killing the patients. And in fact, he notes that the rich have a higher mortality rate from smallpox than the poor, because they could afford physicians, and the physicians would begin to bleed them, and that with smallpox would add to their misery and cause their mortality. Now, it's very interesting. In Sydenham's book about smallpox, he talks about a higher mortality in obese patients, usually wealthy patients, because those are obese patients in London. And in COVID-19, obese patients also have a higher mortality. So it's very similar in both of these deadly virus diseases. Let's go on now to the North American person who wrote about smallpox, and this is Thomas Thacher. We're going to talk about that. Was in your reading also. He was a minister, not a physician, though Cotton Mather felt that they were combined in the same person. He was a minister at Boston's Old South Church, and he put together these guidelines of the diagnosis and treatment of smallpox after an epidemic in 1676 in Boston. And he felt, again, he was giving up Galenic medicine, that patients should not be overheated by too many clothes, too hot a room, hot cordials. But most important, again, he felt he was against bloodletting. He was against enemas. He was against vomits. He was against purges. He was against cooling medicines. He just wanted to take care of these patients and pray. So let's look at some of the public health laws in 17th century England. And these related essentially to the plague, but they also related to smallpox. First, in 1564, there was quarantine of patients, and they would mark the patients who got sick by having a cross on their door. And those who didn't want to stay in their rooms would be forcibly imprisoned. In 1590s, the pest houses began in London. In 1665, there were pest houses outside the walls of London. And in the plague time, the physicians and many of the surgeons left London and the apothecaries remained. It's very much similar to the super rich in the United States now during COVID-19. They go to Cape Cod or the Hamptons to get away from the crowded cities where there's a higher mortality of COVID-19. So in 1665, the Lord Mayor of London put together a set of rules, sort of a junior quarantine to prevent the spreading of infection. There was sequestration of the sick, keeping them in one building, very similar to what China used in COVID-19. They wouldn't allow anyone's infected stuff, their linens, their clothing to be put out of the house. They wouldn't, if they died, they wouldn't allow it to be sold. They marked the houses where people were quarantined, and they had guards watching to be certain that nobody escaped from these quarantine houses. Very similar to China, Korea, Indochina, in order to control COVID-19 very successfully. It was very important that these pest houses in the 1590s be maintained and patients stayed there during the quarantine. If I could go on. I just want to show you now COVID-19. And this is a chest film, a normal chest film. You could see the lungs are the area in black, and the center part is the cardiac silhouette, the heart. And this is a perfectly normal chest film. And now I'm going to show you what happens over 3 days in a patient with COVID-19. In the first chest film over here, there's beginning infiltrates. This is the infection beginning to infect the lung, causing inflammatory reaction and the lung beginning to blacken, and so it can't exchange oxygen. This is within a day. There's this advancement here. The patient's oxygen saturation begins to drop. They're having trouble in breathing. And here is an advanced disease 2 days later now, where this infiltrates throughout the lung. This is a patient who would be considered to be put on a respirator, or if the respirator couldn't provide enough oxygenation, would be put on ECMO, which is extracorporeal circulation, membrane oxygenation. This is a heart-lung machine, which has been used in patients with COVID-19 until we're able to survive this lung infiltration, raise their oxygen saturations, and eventually be extubated and survive. There are several patients who have survived. This takes a massive amount of medical therapy and highly specialized intensive care units to be able to accomplish this. And very similar to, looks almost like smallpox, but this is COVID-19, when small blood vessels begin to get clotted off, and this occurs throughout the body, in the brain, in the lungs, in the heart, in the intestinal tract, even on the skin, and they begin to get clots, and there's no blood supply to areas of the skin. It looks like smallpox pustules, but it's not. Okay. And then what are the COVID-19 public health measures? Quarantine. It looks very much like what we were reading a few minutes ago about what was happening in London. maybe masks, maybe mandated vaccination. We'll get to that in a second. Social distancing, contact tracing. In 1636, the General Court in Boston was so frightened of the smallpox epidemic that they moved to Cambridge. It followed them, and they went off to Roxbury to escape the disease. It was very common for upper class people to run away to their country homes in the 16 and 1700s. Washington did that during the Continental Congress meeting in the late 1700s, went off to Mount Vernon when there was a smallpox epidemic in Philadelphia. And East Hampton, the Hamptons, 1662, there was concern that the Native Americans would come down with smallpox and spread it within the community. So they had a law that no Native American could come into town until they were free of the pox. In 1701, the first Smallpox Prevention Act authorized quarantine, the impressment of houses, as it did in London in the late 1600s, for the isolations of patients with smallpox. Now we're getting to something that's relevant now in 2020. 1905, there was a mandate in Cambridge, Massachusetts for smallpox vaccination. And there were people who were protesting. They didn't want to get vaccination. They had the anti-vaccinators at that time. And so this case went to the Supreme Court. It's called Jacobson versus the Commonwealth of Massachusetts. It's still on the books. It's never been reversed. It allows the government to mandate smallpox vaccinations. Whether this will be going forward, if any government entity wants to mandate vaccination for COVID-19, whether somebody will dredge up this case, whether it will go back to the Supreme Court in the future, it's only speculation, but it's on the books in the United States. This is the last time the Supreme Court looked at this. And again, in the influenza epidemic in 1918 and 19, there were the anti-maskers. I don't know whether they felt it was more masculine not to wear your mask, as people do now, but nevertheless, there was anti-mask mask league in San Francisco arguing about their liberty, and they didn't want the government to tell them that they had to wear masks in public venues. I think that's my last slide, so I'm going to stop now. And Sarah, you could start the discussion. You have to unmute yourself.
Hi, sorry about that. There's just so much. Sid, could you get rid of your slides? Then we can see each other.
They should be off now.
No.
But I'll get them.
Okay.
Anyway,
to me, this was utterly fascinating. There is so much in what you were saying, and such a hi everybody. So much to think about in terms of the past, but particularly what happened to Native American people in New England, but also comparing the situation then to today, and the kind of essential public health measures that have probably been around since at least the Greeks in the West, but certainly we see it in London in the 17th century and as today. So should we just open this up first of all for general comments and questions, and then we'll get into maybe some of the readings and specifics? Does anybody have anything they want to say? Yes. Is that somebody unmuting? If you raise your hand, do the little you click on the participants, and then you'll see something that says raise hand, and click that. That'll indicate that you want to speak. No speakers?
yes,
Oh.
Faith wants to speak.
Okay, sorry, I'm not seeing you, but go ahead.
Can you hear me?
Yes.
Yes.
Oh, okay. I just wanted to ask if you've heard, and you probably have, of a really famous bacteriologist in Rio de Janeiro named Osvaldo Cruz. He actually founded an institute called Fiocruz, Fundación de Infectología de Osvaldo Cruz, And the reason I know all this is because I got malaria 2 years ago in, well, actually 2019. And I passed out. I was taken to Fiocruz and they saved my life by administering, I think it was, begins with an A, I can't remember. Artesunate, that's it, artesunate. And I just, you know, it was really kind of a fascinating experience. And Osvaldo Cruz went through a lot of the same things that the anti-vaxxers have been doing. I mean, people thought he was crazy for introducing smallpox vaccine, yellow fever vaccine. And it's just interesting how maybe throughout the centers, we really didn't learn so much, you know, because we have to keep going through the same cycles of ignorance time and time again.
Mm-hmm. Well, that's certainly true. There is a question from Jennifer Shangrog, she's saying, my ancestors became seriously ill in, this must be 1635, 1636 in Cambridge. Could that have been smallpox?
It's always a possibility. It's hard to speculate.
Yeah. I mean, there were so many contagious diseases, and then people, you know, you could get pneumonia, you could get a cold and die from pneumonia. You could, anything could course through you. I'm not sure about a smallpox at that time.
I have a question.
Mm-hmm.
Thank you for the presentation. I wanted to ask whether you could see in the writings any of the battle between the politicians or the administrators and the physicians or the public health people or the healers, such as we're seeing today? Or was everybody just on the same page because illness was so rampant and everybody would do whatever they could to keep the population from dying?
Well, the secondary information that we have is that they had to have guards outside of the pest houses. They had to mark the houses. They had to be able to insist that patients who were infected, and we're talking about smallpox or plague, stayed in their houses. So I suspect, without any real authoritative data, that there was the same feeling that some people were obeying the rules, trying to do the right thing that was perceived at that time. And there were some who felt that they just wanted to get out and do their own things. You know, unfortunately, mankind hasn't changed that much over 400 years.
Lance, did you want to say something?
Yeah, so you mentioned the smallpox in 1676, I believe you stated that there was an outbreak. And my question to you was, that was just on the heels of King Philip's War, and most of the indigenous people were relegated at that point to reservations or to, well, they were all relegated to reservations at that time. So can you speak a little bit about how the pox ravaged the reservations? And looking at that from the point of view of rationalizing epidemics, was there any evidence that there was some malicious intent there?
I don't know whether they were sophisticated enough for the malicious intent. It may have been there. You know, there's a classic story about Amherst giving smallpox blankets to the Native Americans and also trying to do it to the French. But I don't know whether they really had that type of thinking. But having people congested on a reservation, because the Native Americans lived reasonably healthy lives before the Europeans came over. First thing, as I mentioned before, the hygiene was of a higher quality. The Native Americans, and several things I read, said they could always tell when the Europeans were around because they could smell them, because they didn't bathe as much as the Native Americans. But having people congested the same way that we see it now in United States, in areas where there is a great deal of poverty and many people are living in a small area, there's a higher incidence of COVID-19 as opposed to people who are living in expansive areas, even though it affects both people, of course. So I would think if you push people on a reservation, the chances of infecting each other is much higher than it is if you're out in the country where you could have social distancing, which they couldn't do on the reservations. The probable answer is that the mortality was so high among the Native Americans. I mean, to wipe out 90% of tribes is just awful if you imagine that. So they were vulnerable, and the added congestion just made their vulnerability even greater and led to a greater mortality.
Could I just add to that? I think that we need to take into account actually that people had been weakened through malnutrition because part of warfare was destroying hunting grounds and farmland where Native Americans had their corn and beans and farmed their food. And so people were already, by the time they were herded into these camps, particularly Deer Island, they were already in a weakened condition. So that's another factor.
I can't raise my hand because I'm a co-host. I
Okay.
want to respond to Marva, her question about conflict in leadership. I want to highlight that this is a very different culture than ours. They were very much preoccupied with the, at least appearance of unity. So if you look at their records, they are often downplaying conflict in the community, whereas our modern society plays up conflict because that's what gets people watching the news. So we probably will never know how much contention there was about it. I will give this one example a little bit outside of our period, but when Cotton Mather was looking into inoculation for smallpox, that sparked a violent reaction. People tried to bomb him. So I think that that suggests that people were very, very invested in the public health policy around smallpox, and there may have been conflicts earlier that just didn't get written down, didn't have something splashy like that.
Well, that's true. In 1722, when Boylston and Cotton Mather were trying to push varialization, there was a great deal of anti-vaxxers at that time because people were terrified about using the pus from a pustule and putting it into a seemingly healthy person. And that just didn't fit with their concepts. Also, the university-trained physicians were against vaccination initially. And Dr. Boylston was sort of considered a pariah by pushing vaccination. So there's always been conflict. About the Puritans, I think, when they had to quarantine people and they had to establish rules about people not leaving quarantine, that sort of suggests that there was that everybody wasn't singing from the same hymnal. There was a lot of dissension.
Sid, there is a question from Lori, I think I can't read it, title, saying in the 1750s, there was a smallpox outbreak in Boston. How did physicians treat it? So by then there's a vaccine.
Well, there wasn't, you don't treat smallpox with a vaccine, you prevent smallpox with a vaccine. And the treatment that they had is the same treatment they have now for smallpox. There is no treatment. You do the same way we're doing essentially with COVID-19. You do your best to sustain the patient. They hopefully weren't exsanguinating their patients at that period of time. And they were just trying to provide fluids and good nursing care, keeping the patient clean, waiting for the body to take over and hopefully reverse this horrible disease. But the mortality was still high before vaccination.
Another question from Deanna Ballard. She says that you mentioned obesity. Have you learned much about obesity back then? I never really imagined any of the colonists or Native Americans of the 17th century as being overweight.
Just in one of the pamphlets, readings that I had, they just in passing mentioned
Yeah,
that overweight patients had a higher mortality from smallpox.
that's in the Thacher, I think.
Yes, but and we do know there's a higher mortality in COVID-19 because that, you know, that's associated with diabetes, high levels of inflammatory illness. So it has many comorbidities associated with it.
Yeah. I have an observation, which is, and then Jennifer's commenting again, but my observation is, even though when you read Thatcher's A Brief Rule, the broadsheet that was printed and posted up publicly in Boston, it looks as though, you know, what does he know about smallpox or something, but it actually, there's so many similarities between his effort to convey a calm public health message and the article about that you gave us from the New England Journal about mild or moderate COVID. So he's looking at what are the, you know, what are the signs, what are the treatments, how do you manage it, what are the prognoses when you see symptoms worsening. It's he has a very measured, authoritative tone of voice, which is meant to calm people when they're obviously terrified. And actually, he doesn't mention, what is really striking is, even though he's a minister, he does not mention God at all. This is all about natural causes and natural cures. He doesn't mention prayers.
But most important, he's against bloodletting.
Yes.
And I
Not
think
entirely. No.
not entirely, but at least for the treatment of smallpox.
Yes.
Because when you begin to exsanguinate a patient who is deathly ill from an infectious disease, then they're going to throw them into shock and they're going to get even worse. So that was just a horrible means of therapy.
Yes. But it made me think about what are the public health messages coming out in Boston from the authorities in Boston. And he obviously would have been a leading one. He was Old South Church's first minister. And this would have been put up as a single page broadsheet all around town. And just the tone of voice and the kind of practical approach might have helped to dispel some of the panic.
Well, I'm sure, but he was also effective in quarantining and
Yes.
keeping patients in a room. And he didn't use the word social distancing, but that's what they were saying at that time.
He doesn't talk about it. He doesn't talk about quarantine.
Yeah, they didn't really understand the smallpox wearing masks because that was a way of spreading the disease. If they had pox in their mucous membranes, coughing would spread the disease also, besides just touching the skin. So
a few more comments.
Nevertheless, they used the tools that he had, and I agree with you. He was promoting good nursing care, which is the hallmark of a treatment of an illness if you don't have any other drug to treat it.
Mm-hmm. And he is assuming that people are not fleeing from the patients.
Well, the good people are not.
The family, yeah. A couple of comments. Jennifer comments that other than scars are asked, did smallpox cause any long-term effects? She herself is a polio survivor, and she post
very high incidence of blindness in patients with smallpox.
Yeah. Anything else? Anything other than blindness and scarring?
I don't know, having never treated a patient or seen a patient with smallpox, but I'm sure if you have a disease that deadly, you go through this, there's multi-organ injury that may not show itself very early, but over a period of time, maybe they get earlier liver disease, maybe they get earlier pulmonary or lung disease, because it's very debilitating to go through this process of smallpox. But again, there's variation. We have patients now who have COVID-19 who don't realize they've had COVID-19, and we have patients who are on respirators who eventually die with COVID-19. So there's a wide spectrum of individuals' reaction to any of these viruses. It's very genetically oriented, and we don't understand it yet.
Here's a question from Jacqueline about a century after our time period, but maybe you know the answer. She is curious about the Revolutionary War and Washington's troops. Was smallpox a big problem for both the colonist troops, the colonial troops, and the British?
Yes, and when Washington came to Cambridge and took over, he asked that all his troops be vaccinated.
Mhm.
So he was very cognizant of it. He had a Surgeon General who helped him, but he was very cognizant. And at that time, vaccination was well known and ubiquitous. But when we read articles about the Army, particularly when they were at Valley Forge, which was just a perfect setup for the spread of smallpox, we don't read, at least I haven't read, maybe others have, that there were any epidemics of smallpox among the Continental Army. I'm sure there were a few anti-vaxxers who may have gotten it, but it's not really mentioned.
If you read Boston, there's the town of Boston records for that period, and a little bit later, you'll see that they made incoming ships wait in the harbor for, I think, 30 days. And there were smallpox hospitals where people were quarantined. They weren't left in their homes. They were taken to the hospital. And that included people of color as
That's
well.
right.
So everyone, at a sort of fundamental level, at least slavery had not yet been abolished, but they recognized everyone was human and had a right to life and care.
I mean, quarantine was not uncommon with immigrants during the large Irish migration to Boston. Deer Island was a place where they would place many of the Irish immigrants who appeared sick. They had a hospital over there, and there was a high mortality. There's a gravesite for from the Irish immigrants on Deer Island who had this in the 1800s. So quarantine, hospitalization for people who were coming over to the United States in the late 1800s. The big migration from Eastern Europe had the same thing off Ellis Island. They had a hospital over there where they would quarantine people.
There's a recommendation that everyone have a look at a brilliant TED Talk. So I can't give you the link, but if everyone looks at the chat, you'll see it. It's about his efforts to eliminate smallpox and stop future pandemics. A question about the comparison between the plague. This says medieval Europe, but actually it goes right up through our period. 1666 in England was the end of the plague in England, but it carried on elsewhere in Europe. How does that compare to COVID-19? Or smallpox for that matter?
Well, plague was Pastorella pestis, so it was a bacteriologic phenomena. Rodents were a major factor. Sanitation was an important factor. COVID-19 is different. We have a reasonably sanitized society in Western society and also all over the world now, but yet COVID-19 is being transmitted very rapidly through coughing and droplets and respiratory things. And we don't have a carrier such as rats to carry the disease from place to place. So I think there are significant differences.
But actually you did read out, or you listed some of the plague, the rules, the public health rules.
Quarantine was important.
Yeah, they were the very same rules. You isolate, right. You care for and there was innovation by some of the physicians who took care of plague patients. So good nursing, good food, give them strength, separate the sick from people who are well. So the same public health meures.
That's exactly right.
Yeah. There is a comment from Mary saying that there was a smallpox barracks on the land where her house sits now on Winter Hill, and a link. That's amazing. So a barracks, was it for military or was it just a smallpox quarantine center?
And when was this?
Yeah.
This was 1776. It was during the, after Bunker Hill, they created a fort, a Winter Hill fort on the top of Broadway. If you've ever driven through Somerville, right up at the top of Broadway, there's a hill and you can look right down onto Charlestown from there. And there was a fort that could have prevented the British from rolling up further into New Hampshire or whatever. And so there was a fort there, but it wasn't heavily used. So they gave it to Medford for the Smallpox Hospital.
That's
Wow.
great.
That
I
was-
didn't know that at all.
If we're ever able to, we can have little field trips when life begins again and go see it. That would be fantastic. Anyone else?
So I had Sid, one other thing I wanted to ask. So if you look at the extraordinary difference with, the outbreak in 1676, or even allegedly the one just a few years before that, and today with COVID-19, where there's such a library of misinformation and so much struggle about people who believe that they should be doing things that the public health officials are telling them to do. It just seems to me that, with all these things we've learned about these things, that how did we get to this point where the narrative has been so controlled by certain media outlets or even by politicians, where back then the narrative was really controlled by the religious establishment, but I'm assuming there was more of a conformity to doing the things that they were asking people to do then. And if you think about these 400 years that have or 350 or so that have come between us, how we got to be this nation that has had such a failure with this particular instance of a public health epidemic. It just seems to me. Can you speak a little bit about where the disconnect is, or where the?
Well, I could only tell you my personal views. I think we've had a great deal of politicization of the COVID-19. We haven't had any respected public health officials taking over. So we have had a certain anti-science feeling in this entire issue. But most important, they didn't have the web in 1676. We have the web now. And there is so much misinformation that's being spread. And people become true believers. It almost becomes a cult of what people believe from what the things that they hear on the web. And I don't know how we're going to battle that or manage it. We have to have our leaders, our political leaders, doing the right thing and supporting good public health measures, supporting the FDA and CDC, which we've had a little back and forth over the last year, which has not been healthy for our society and may be responsible for the very high mortality that we see in the United States as compared to Germany, which has a much lower mortality, same disease.
Susan is asking, Sid, whether you found in your research that there was a pattern that when smallpox broke out, it would travel west, so that you had an early form of contact tracing.
It would,
It would presumably start at the port and then move inland.
I don't recall reading about that. It may very well have been that somebody with smallpox left Boston and went to the Berkshires and transmitted it. But I don't recall any specific reading about that, but I'm sure it existed.
Well, I think in the Jones chapter, he talks about the fact that it was not widespread before 1600, when you just had, or even just after 1600, when you just had little fishing encampments along the coast and you didn't have people moving inland. And yes. I imagine that protected people considerably.
But the Native Americans who got infected, they would have moved. I don't think the English fishermen from Bristol were moving inland.
No.
But I'm sure that the Native Americans, as they were moving, were transmitting the disease or carrying the disease with them. It was just horrible.
Can anybody hear me? So I can ask a question?
Yes, go ahead.
Hi, I'm Chuck Morrison. I'm John's brother, actually. And the reason I'm calling is that I was in the Peace Corps in Malawi and saw a case of smallpox while I was there that came into Malawi. But more important than that is that one of my Peace Corps buddies became part of the World Health smallpox eradication team in the 70s and dealt with smallpox in both the Congo and Bangladesh. And he made the comment, and Doctor, you had, I think you said that that smallpox had transspeciated, like, and I may have misheard you, like having, like the bubonic plague, where the rats were a vector, where COVID-19, we believe came from bats, another mammal. And he made the statement that since smallpox didn't have a history of transspeciating, it was easy to eradicate because the only vector was human beings. And once you get them all vaccinated, that was the end of it. But with COVID-19, since it does transspeciate, he was saying it's going to be more difficult to get to ever eradicate it. It will probably always be around, like measles, and we'll just have to continue vaccinating people, and we can keep it out of the most of the human population, but it will still exist in other mammals. Did I hear you correctly to say that you'd never heard of smallpox transspeciating, for lack of a better term?
As far as I know, it has. Don't forget, I am not an infectious disease expert, so there may be some research that focused on that, and I'm just not familiar with it. But the only way at the moment that we're going to have some control over COVID-19 is through herd immunity, which means that we have to have a large number of our population. And nobody knows the number, whether it's 70% or 90%, that either is vaccinated or has had the disease and has survived and has antibodies, so we don't have community spread. Right now, we're undergoing enormous amount of community spread. And so we have to be able to contain it. Whether we'll totally be able to eradicate it, as in smallpox, there are only 2 centers, as far as I know, that has the smallpox virus, one in Russia and one in the United States, but the rest of the world, it's completely gone.
Right.
I don't know whether that will occur with COVID-19. I suspect not, but I really don't know. I'm just not expert enough in that area.
James has added a comment that according to the CDC, only humans spread smallpox. So
yeah, that's what I heard. And he was drawing. I'm sorry.
Yeah. I have a question. Did anybody read the David Jones article and about the impact of disease, smallpox in particular, on the Native community in New England? Because I found that very difficult to read, even though I have read these things in the primary sources and other articles, but the level of devastation, 90% mortality, I wasn't sure how he got these figures, but also just if you think about the level of grief that people and the devastation and the trauma that people would have experienced, it was just really struck me all over again. That's a comment. But also I have a question. I don't know if any of you, Sid, or anybody else knows an answer. Is there any record of a Native American voice to that experience? Because that's so fundamental. It is worse than HIV in Southern Africa. It's worse than the plague. It's worse than anything except in Latin America. So is there any Native American voice that can speak to that time? Because we hear the Puritan side, we don't hear the other side.
Well, when the Pilgrims went to Patuxet, that was previously a Native American village that essentially was wiped out. And when Squantum came, he was one of the few survivors from that village. And he looked around and there wasn't anybody there. So I don't know whether people recorded his statements, but I've read this time and time again when he came back after, don't forget, he was enslaved. He was enslaved by the Europeans, managed to escape from Spain, wound up in England, and managed to get passage back to North America. So he was obviously a very bright guy. And he came back to a village which was empty. It's tragic.
And really the only record would have been if the pilgrims or the colonists had recorded one of the indigenous people speaking about their grief or anguish around those things, because we didn't have a written language. So there would not have been anything other than that. And I've seen very little in anything that speaks directly to how that had affected so many of the indigenous villages. But you can imagine that people who had no understanding of why everyone was dying so quickly, and they died so fast, and having no way of understanding what it was to understand how to properly express grief, especially when there was such a ritual around how we buried people and how many people died so quickly. It's almost been, to your point, Sarah, lost to history how much that that must have affected the people who survived. So
greatly. It's just an overwhelming.
The other piece of that too is that the fact that we did survive is no small miracle in some way. So that, there's something to be said about. And what I found interesting about Jones's book is he goes through and talks about all the different time periods in which indigenous people have been inflicted, and disproportionately indigenous people and Black and brown people disproportionately to certain diseases, such as smallpox. We see the same thing with COVID-19. We've all witnessed that on the Navajo reservation and so forth. But for some reason, we have survived these things, maybe in smaller numbers, but there's a certain survival instinct there that goes beyond the biology.
Yeah. Yes.
Jones had spent time on the Indian Health Service. He's a fellow faculty member in the medical school and has spoken at the Partnership of Historic Boston's a couple of years ago. And that is a very powerful book.
Yes.
That he describes, because he integrates, and this was mentioned by Sarah, both the disease as well as the lack of nutrition, the end of their hunting areas, so they're unable to feed themselves, unable to move. Because, part of the ability to maintain good hygiene with the Native Americans is they were moving. So they didn't contaminate an area, stay in a village for a long period of time and contaminate the area with human waste. They were always moving. So, and they bathed a lot.
Yes.
So, that's why they, perhaps that was helpful in their the few who survived. That was probably very helpful.
Oh, Marva, you have something to...
Thank you. I wanted to add a slightly different voice, but I don't have any direct quotes, so I'm going to stumble through this. There were about probably 1,000, let's say 1,000 slaves in Massachusetts by this time, by the early 1700s, having started to come here fairly early on in the slave trade. So from 1650, say, through the 1700s, there was an accumulation of African heritage people.
Mm-hmm.
And one of them actually is given credit for convincing Cotton Mather to try this, I don't know if he called it a vaccination, but he said, I'm sorry, what do you, variolization? Yeah, yes. And I wondered whether, when we were talking about this earlier, I wondered whether when Cotton Mather went into the community to talk about this and to speak with Dr. Boylston and so on, whether that had an effect, saying, oh, he's an African slave, what the hell does he know? I don't know that, but he is quoted. Mather gives him a name and speaks about his contributions. The other thing I wanted to say in terms of the African people in Massachusetts, there are slave, what do you call them, bills of sale. When slave ships would come into the port, the bills of sale would say whether people on the boat were free of smallpox. Well, they'd say they were free of smallpox because they're trying to sell people They probably wouldn't say that they had smallpox and so I'm bringing them to you directly. You know, these are your smallpox people. But just to add, you know, we're talking about a great number of people, and it's a broader concern than just with the white colonist settlers and the the Native American population.
Yeah,
Smallpox is a terrible thing all around.
Well, you know, if the Black slaves came from West Africa, then there was a high percentage of those who were Muslim. And many of those because Muslim had a higher level of science at that time, Islam, than Western Europe. And vaccination was not uncommon. And it's claimed that about 20% of the Black slaves who came to North America were Muslims, and then they underwent conversion. But those who came from the Muslim Western Africa probably were vaccinated there or varialized there at that time, because that was a common practice in Islam and also the Ottoman Empire.
There is a comment that Sid, you might want to pick up on this a little bit about Deanna saying that she wasn't aware that there had been such an anti-mask, anti-vax pushback in previous times. That it seems as though it's special to us, but it's not. But could you say a little bit more about resistance to vaccination from its beginning?
I mean, we've had this in United States, unfortunately, before the COVID-19. There's been groups throughout the country who have been refusing to vaccinate their children. And the danger is that the child comes to school with chickenpox and measles. Measles is a deadly disease. As a young medical student, I still saw patients with measles, and people die with measles. So it's not a very pleasant disease. And I don't understand their thinking, but people have a right to think, but they don't have a right to hurt the general public. So how do we manage this, people's perceptions of liberty and their rights? We know there's a Supreme Court ruling, as I showed before, that mandates that the government has a right to force vaccination. Whether that ruling is being enforced or has been enforced, I don't know. But I do know that pediatricians complain that there are groups of parents who just don't want their kids vaccinated against polio. I mean, these horrible, horrible diseases, they just don't want them taken care of. So how are we going to balance that, our society? That's a political, sociologic question. Not necessarily a physician could only provide the data and say everyone should get vaccinated. But how does society, general society, deal with it? That's a question that our politicians, our public health people are going to have to deal with, and hopefully educate the rest of society.
But there is a general fear or mistrust in Indigenous and Black and Brown communities about vaccinations because of what in the past has been done to certain people through history with experimenting on them. So, and I'm definitely one of those people who say people should be vaccinated. We have to get these under control, but how do we get that? That's not a conversation that the physicians need to have, but in general in our society, how do we get past that conversation? Because I can tell you that many of my Indigenous friends and my Black friends and Brown friends are totally completely against this vaccination. So, you know, and that comes down through, you know, things that have been experiments that have been done on people of color, have been done on Indigenous people. So there's this definite problem we have in our society about people believing that this is actually not going to harm them. And those of us who say, you know, like you said, Sid, that we need to have a better conversation about the merits and the values and of being vaccinated, especially with this particular situation that we're living under right now.
Well, you know, we have this history in the United States of the treatment for syphilis. and people who were treated and weren't treated in the Black population. And that was a horrible experiment.
Yeah.
At least for me, I think maybe we should talk about it so it's open, it's not whispered, and then say how we could overcome the resistance and try and not only apologize, but also I think fresh air sometimes and exposure to sunshine and talking about these issues, why they're there, why these experiments occurred, and so it becomes general public knowledge, so we could have some understanding why people are terrified of vaccination, particularly Black and brown people and indigenous people, because indeed it did occur.
Yeah. You have to have a reason to trust.
Yeah.
That's exactly right.
But
And Jones discusses that in his book. He does discuss the mistrust and the things that have been done that have made people of color a little bit more reticent about, trusting medical professionals. So I think that the more honest we can be about, bringing the conversation up, the better chance we have of bringing everybody into the conversation.
yeah, I just want to say one thing and then go to a comment that somebody made, which is very powerful, which is, I think, so this is the original, a copy of the original broadsheet by Thacher. And so this would have gone up everywhere on walls and outside the church and so forth. So, and this is a minister, a prominent minister in Boston saying to people, this is a serious matter, you can deal with it, and not talking about God. So that's like a strong, united public health statement from the top reaches of authority, and the city government likewise. So I think we'd have to do more research into this, but I think that the Boston Town meeting and the Boston Town authorities were very united. There was dissent, but they were quite united and provided clear leadership about vaccination, despite the pushback, and about the need for people to take care of themselves.
I want to jump off of that.
If you look now in our present COVID-19, and the most prominent public health epidemiologist person is Anthony Fauci,
Yeah.
how he's been applauded and shot at, and he
Right.
has to have bodyguards surrounding him, and surrounding his family has been threatened. This is a doc at the NIH. He runs infectious disease and epidemiology, a very prominent person, and he's been castigated. So why should that occur in our intellectual 21st century society?
So I wanted to jump off Sarah. One of the things, so this group in the past had a fall series about healthcare and our understanding of medicine and health in the 17th century. And one of the things I remembered from that is there's at that time in Boston and the Massachusetts Bay Colony, very much a conflation of societal authority and responsibility with medical knowledge and being a physician. Like, if I remember correctly, the Winthrop family was known for being good physicians, and that was part of their authority in the community.
Mm-hmm.
And so it seemed like much more than if you wanted to be one of the top people in society, you probably had to be able to at least present this sort of authority. And I wonder if that has any sort of influence over how they handled public health crises versus now, when it's very much more specialized. If you're a doctor, for the most part, you don't have time to be also leading political figure in your society.
Mm-hmm. Yeah, I'm not sure if we want people in the White House to be our physicians too, but it's true that in the 17th century, many ministers were physicians, like Thacher also practiced as a physician, and John Winthrop and his son, who was
when he was governor of Connecticut.
Yeah. Could I just come on to Barbara's comment, because it's very powerful. We're going to run out of time. This is important. So she comments that she was very struck and deeply saddened by the high rate of death among Native Americans, and that fact is not being taught in schools, or at least not when she was in school. And she hopes that in the future we are more aware of what actually happened. And I just think that's a comment that's worth.
Well, part of the mission of the Partnership of Historic Bostons, who's sponsoring this evening, is public history, to illuminate issues like that to the general public, so they've begun to understand that what they learned in school is perhaps simplified, and it's a very series of complex events that occurred as our society advanced over a period of time. And I think this evening is just reminiscent of that, how important it is to spread this information to the general public.
Yep.
Okay.
Okay. Any last words? Oh,
John, do you want to say anything? John is the president of the Partnership of Historic Bostons.
Oh, there's another comment that's come in though.
Okay.
Sorry, before John, that Carol's commenting that her daughter is homeschooling her children, and their courses this fall include a lot of reading about injustices to Native people and African Americans. So those of us who are in the older generation didn't get this when we were growing up, but hopefully things are changing now, which is important.
I would just like to thank everyone and mention that Onesimus actually showed Cotton Mather his scar from inoculation, and actually taught him the technique of inoculation as was used in Africa when he was a child. That was one of the things that convinced him. And Thacher was such a good man, and he died 2 years later. He thought one of the really prime purposes of a minister was to go and be with people during their last sufferings, and he caught something and actually died having attended to a sick person a couple of years later. So that was his end demise, but very loved person. And this has been a very fine session. It's one of the things that Zoom has helped, is to be able to have these conversations from a wide variety of people in a wide variety of places, and whatever happens in the future. I think that we ought to continue these discussions electronically, because they're so open to people and so meaningful. So, been a good night.
Yeah, thank you very much from California.
Yeah, there you go.
I really enjoyed, your East Coast perspective, in that when you refer to these places, to that are kind of mythological to us on the West Coast. Although I've been to Concord, I have been to Boston, but it's the place you live. So you have such a deep familiarity and knowledge that it's really interesting, and very interesting topic. Thank you.
Yeah, thank you. Thank you all for attending.
Thank you.
Thank you. Thank you.
You'll come back again. We're going to do a series in January, February, March. Hopefully Lance on Deer Island, and yes, and that would be great. And then I think that we will do one on the diary of a Puritan minister in Essex in England, because of his kind of deep religiosity, and also he writes really well. He also writes about illness all the time. He's always in a panic. I'm getting a cold, and my wife has a cough, because the consequences of getting ill were so grave. And then we might also be looking at Cotton Mather's writings on slavery, which are interesting, shall we say.
And continuing the dialogue of what it meant to be Puritan in Puritan times too.
Yes, yes.
And thank you for recommending that superb Rationalizing Epidemics book.
Yeah, isn't it good? He's a good writer, Jones.
Okay. Thank you,
Okay,
everybody.
thank you.
Thank you.
Have a good rest of the evening.
Right.
And
Bye.
all evening in California.
Thanks, everybody.
Thank you.
Bye.